Reviewing herbal blends, effective natural options for tinnitus. The following questions address the most common concerns about using herbal remedies for tinnitus management. These answers are based on current research and clinical experience, though individual responses to herbal treatments vary considerably based on tinnitus type, duration, and underlying causes. How long does it take for herbal remedies to reduce tinnitus symptoms? Most herbal remedies require consistent use for 4 to 12 weeks before significant benefits appear. Unlike pharmaceutical drugs that often work quickly, herbs typically produce gradual improvements as they address underlying imbalances. Ginkgo biloba, for instance, usually requires 8 to 12 weeks of regular use before maximum benefits are achieved. Some people notice subtle improvements within the first few weeks, while others may need several months of consistent use. Maintaining a detailed symptom journal helps track these gradual changes that might otherwise go unnoticed. Can herbal remedies cure tinnitus completely? While herbal remedies can significantly reduce tinnitus symptoms for many people, complete elimination of tinnitus is rare, especially for chronic cases. Herbs work best as part of a comprehensive approach that includes addressing underlying causes, such as hearing damage or circulation problems, managing stress, improving sleep quality, and protecting ears from further damage. The most realistic expectation is a reduction in tinnitus volume and distress, rather than complete disappearance of symptoms. Though some people with mild or recent onset tinnitus do experience complete resolution. Are there any herbal remedies I should avoid if I have tinnitus? Certain herbs may actually worsen tinnitus symptoms for some individuals. Quinine-containing herbs like cinchona bark can trigger or intensify tinnitus, as can high doses of stimulant herbs such as ephedra, guarana, and excessive caffeine from tea or coffee. Some people report temporary tinnitus exacerbation with salicylate-containing herbs like meadowsweet and willow bark. These reactions vary considerably between individuals, highlighting the importance of introducing herbs one at a time and carefully monitoring your response. Additionally, herbs that increase blood pressure or stimulate the nervous system may temporarily worsen tinnitus in people whose symptoms are aggravated by stress or circulatory issues. These include mahuang, ephedra, guarana, yohimbe, and high doses of licorice. Always research potential side effects before trying a new herb, and discontinue use if you notice your tinnitus worsening after administration. For more information on which herbs to avoid, check out this guide on top herbs for tinnitus. Should I stop taking my prescribed medications when starting herbal treatments? Never discontinue prescribed medications without consulting the healthcare provider who prescribed them. Herbal remedies should typically complement rather than replace conventional treatments, especially for serious underlying conditions that may contribute to tinnitus. If you're concerned about interactions between herbs and your medications, work with knowledgeable healthcare providers to develop an integrated approach. In many cases, timing the administration of herbs and medications several hours apart can minimize potential interactions while allowing you to benefit from both approaches. For more insights, you can explore herbal teas for tinnitus relief. What's the difference between Western and Eastern herbal approaches to tinnitus? Western herbalism typically focuses on specific herbs for symptom relief, often using single herbs or simple combinations targeted directly at tinnitus symptoms. This approach emphasizes understanding the pharmacological actions of herbs, such as improved circulation from ginkgo or nervous system support from passionflower. Eastern traditions like traditional Chinese medicine and Ayurveda use complex formulations addressing the person's overall constitutional pattern, rather than just the tinnitus symptoms, often requiring professional assessment to determine the appropriate formula for your specific imbalance pattern. Both approaches have merit, and many practitioners now integrate Eastern and Western herbal traditions for tinnitus management. While Western herbalism may be more accessible for self-treatment, the personalized, system-based approach of Eastern traditions often provides more comprehensive results, especially for complex or long-standing cases. For optimal outcomes, consider working with practitioners familiar with multiple herbal traditions who can customize approaches based on your specific needs. Finding relief from tinnitus often requires patience and a willingness to explore multiple approaches. By combining well-researched herbal remedies with appropriate lifestyle modifications and professional guidance, many people experience significant improvements in both tinnitus symptoms and overall quality of life. Remember that herbal medicine works best as part of an integrated approach that addresses the underlying factors contributing to your specific tinnitus pattern. Herbal remedies have been used for centuries to treat various ailments, including tinnitus. Many people turn to natural solutions in search of relief from the persistent ringing in their ears. While some herbal blends may offer temporary relief, it's essential to understand which ingredients are most effective. For example, Ginkgo biloba is often cited for its potential benefits in improving blood circulation, which may alleviate tinnitus symptoms. However, it's crucial to approach these remedies with caution and consult with a healthcare professional. For those interested in exploring modern alternatives, the use of neuromodulation devices has shown promise in providing relief for tinnitus sufferers.